Hi, my name is Terry Dorland with Rise Local TV, and I am here with Dr. Mel Friedman, who is an optometrist and the owner of For Your Eyes Only in Memphis, Tennessee. And today we're going to be discussing finding a great optometrist and what you should be doing when you're out there looking for a new optometrist. Dr. Friedman, how are you?
Good. How are you? Thank you for having me.
It's great to have you here, Dr. Friedman. All right. So what should people actually be looking for, Dr. Friedman? There's 10 results on the first page of Google alone. Everyone's got a website touting how great they are. From your expert standpoint, what should people be looking for when they're looking for a new optometrist?
Well, I think number one, everybody says that they have a great website, they do this, this, and this. Credentials are extremely important, at least in my opinion. Credentials. What are they credentials? Everybody's equal in the fact that we all have a doctor of optometry, but how much further does that doctor go? For example, in my office, we have a physician such as myself that has finished a residency program in optometric medicine and did an externship at the University of Tennessee family practice. Credentials are extremely important. The more broadened the credential is, the more wide scope the practice becomes, and the easier it is for the physician to be able to diagnose particular areas of concern. And when we talk about eyes, hopefully the optometric physician today doesn't just look at eyes, but he takes the totality of the entire bodily system into effect, because many times we find systemic diseases are related to eye issues. Therefore, the optometrist or the optometric physician today is able to figure out certain things through eye symptoms and refer to the appropriate physician, be it neurology, be it retinal physicians, etc., including gastroenterology. All these kind of things we found in our office in order to refer to the correct PCP or secondary physician.
And you talked a little bit about credentials. Also talk a little bit about experience, Dr. Friedman. How should that come into play?
Experience is obviously important. The more patients you see, the more experience you have. For example, in our office, we've seen everything from A to Z, from iritis to uveitis, which is another form of it, to chorioretinitis, to macular degeneration, you name it, glaucoma. We've seen it, we've treated it, and that's what other physicians also do. And that's what's important about optometry or optometric physicians. They're the primary care, the primary eye care of today's world. They become the gatekeeper, so we're the first people that most patients will see. With that in respect, when there are certain conditions that pop up, it is up to us to make sure that if we can't treat it correctly, that we get that patient to the appropriate physician that can.
That makes a lot of sense. And also, Dr. Friedman, talk a little bit about reputation and how that comes into play. I know you mentioned credentials, slightly different, but how would the reputation of that particular practitioner come into play?
I think reputation is extremely important, not from the person who goes online, because again, we can't please everybody, whether it's me, whether it's a physician down the street. Somebody isn't going to like A or B because of personality or whatever. You can't please everybody. But what you try to do is that every single patient that comes into our office, we go over backwards to try to help. And if we can't help them, we'll try to make sure we get them to the right place that can help them. We're fortunate in the fact that we have many physicians, both primary care and including surgery or surgical physicians, that refer to us for specific issues. That's important, and that establishes reputation as well. Talk to your friends. Find out the kind of experiences they have. It isn't the question of, gee, I don't like this guy, he's a jerk, but more important, what is the end result? Well, yeah, maybe you didn't like him, but how do you see? Well, I really see great. Well, good. He sees great, but he's a jerk. Those two don't seem to go hand in hand. So what we need to do is figure out what is the end result of the patient. Do they see well? Are they comfortable? And how was the office? Well, the office was really good. The staff was wonderful. And, there are certain doctors that say, hey, you either do it my way or you hit the highway. Those are the kind of doctors you really look for, because those are the kind of doctors that say, hey, you know what? I care about you. I care about your eyes. Therefore, that's the reason why I want you to do it my way, because I think I know best because I'm the physician. On the other hand, that doesn't mean the physician isn't going to listen to you, because he should be listening to you as well. And between the physician and the patient, they should be able to come up with a comfortable treatment plan that both are happy.
That makes a lot of sense. That makes a lot amount of sense there, Dr. Friedman. And I know you're doing some special things over at your practice at For Your Eyes Only. Talk a little bit about the patient experience if someone were to come in and see you.
Well, one of the things we do, which we're very fortunate on, we're really on the cutting edge of the newest appropriate type of diagnostic treatments as well. One of the new things that has come into play is what we call biomarkers. That means we can predict through either blood testing that we do in the office or swabbing of the eye or swabbing of the cheeks, etc. We're able to predict such things as macular degeneration before it gets started. We can predict Sjogren's syndrome, which is a dryness, inflammation, or indication that we do through a simple prick of the finger and sending that off. And if we find a positive results, we will also send them to rheumatology. We can do things such as adenovirus detection to determine, is it allergy, is it an allergic reaction to the drug itself, or is it a virus? These are very important things that patients need to have when they come in with red eyes or other such things, or family history of glaucoma, or family history of dry eye, or family history of macular degeneration. We can get ahead of the disease with these particular tests.
Well, that sounds fantastic. I know you have a special offer here, Dr. Friedman, for people who happen to be watching this video, to give them the ability to come in and see that difference that your office provides. What do you have for people that are watching this video today?
Well, one of the things that we try to be very empathetic with, excuse me, is the fact that many patients don't have vision insurance. Those are the patients that really suffer in the fact that maybe do not get the best quality of care, excuse me, not just from the physician, but more so even from the hardware. So what we try to do for patients that do not have vision insurance, we will offer them a significant discount depending on the frame, but usually a minimum of 25% discount straight across the board.
Wow, that's fantastic. That's going to save people a lot of money. What's the best way for people to get a hold of your office to set up an appointment and take advantage of that offer?
They can call the number, which is 901-737-4393.
Dr. Friedman, I appreciate you being here today. You've really given us a lot of great insights.
Well, thank you for having me. And again, if there's anything else I can do, or if a patient feels like they just need to talk to somebody, they need to talk about their eye problems, call the office. If we can't solve it, we'll send you to the person that can.
All right, Dr. Friedman, thanks again for being here, and thank you everyone for watching. We look forward to seeing you in another episode of our live interviews in the future.
Thank you for having me.